Now we're trying to actually go around the issues of what history taking in obstetrics and gynecology. History taking in obstetrics and gynecology. So for this lecture, we're trying to look at questions you shouldn't miss out. Like, you're supposed to actually access somebody, okay? Access a woman. She came up with complications and all of that. So you're trying to access her. So what are the questions you shouldn't miss out? Okay. So first of all, you should know that thorough medical history. Now, a thorough medical history involves asking all these questions. Okay, because these are informations or a set of information that you shouldn't miss out. So it will help you to diagnose accurately. It will help you to know the type of help that the patient needs. It will help the patient to be happy because you attended to them and they felt it. Okay. So first of all, the information you shouldn't miss, things like what? The general patient history. So general patient histories are there. Please pause and observe it, right? Now, I'm not actually wasting time. This is because we have already spoken in depth on medical history taken in obstetrics and gynecology. You understand? But I'm just coming back to just talk about all the aspects. The menstrual history. Alright, so you get to know things like when did she actually start menstruating, is her cycles actually going well, when she's menstruating is there pain, do you understand, and all of that. So pause to also observe everything you're supposed to ask under menstrual history. Then obstetric history, you ask this, okay? For every time she has given birth, for every time she has become pregnant, you ask her which year. Okay, at what age did she at what age of the baby was the baby delivered? How was the baby delivered? Do you understand? The gynecological history, you ask things like, has she been feeling pains? Has she ever had any sexually transmitted infection, pap smears? Has she ever used contraceptives? Okay, fertility concerns and all of that. Sexual history, when did she start having sex? How many sexual partners does she have in the past? How many does she have active now? Do you understand? This one I'm just trying to pick up if there's any infections coming up. The medical and surgical history, you get to know if there's any disease conditions that she's having in any system at all. Okay, that has been there for a very long time. They also ask if she has ever had any hospitalization or surgeries before. If she has ever had any, they give her any drug and her system didn't like it, all those things. Family history, you ask around if any person in the family have similar issues to what she's having, or if they have any other issues that run in the family. The psychological history, then review of systems, where you have to leave the genitourinary system and also look at other systems too. Okay.